Practicing medicine without insurance is possible. Imagine a private practice where you get to see your best patients every day, providing medical services you truly enjoy, all without the hassle of insurance. My name is Dr. T. Nguyen, and I'm a recovering specialist who was completely burned out from insurance-based medicine. I pivoted into direct care, where patients pay me directly for my medical services and have never looked back. If you're a private practice owner or planning to become one who's looking to be free of the grind of insurance and you're craving simplicity, efficiency, and connection with patients, you are in the right place. This podcast will help you map out your exit plan and uncover the mindset needed to thrive in today's economy. Welcome to the Direct Care Podcast for Specialists. Today I have Dr. Stephen Lewellis, Dermatology. And guess what, guys? He also has a podcast, the Direct Care Derm podcast. He has gone out of insurance and owns Above and Beyond Dermatology. And who doesn't love a dermatologist? Come on, let's be real here. Welcome to the podcast.
Thank you very much, T. As I was saying off air, I'm a big fan, and it's always fun to finally be chatting with someone who I think we've talked in other forums prior, just kind of back and forth on LinkedIn and things like that. But it's great to be on your show. You are an inspiration, and the people you talk to are as well. You're leading the way. And what people need is examples. And that's why I'm here. And that's why I want to talk to you and reach your audience with what I'm doing. We're all doing it a little different, but I think what we can all agree on is that we're a whole lot happier than we were when we were stuck in a box.
Oh my gosh. Happier is an understatement.
Yes.
Yeah. So let's talk about you, because I spent the last 2 years talking about me. It's your turn. So how did you decide to venture out to own your own practice? What was life before? What did you hate? What's the gossip? And what's going on?
Life before was 4 years of being what unfortunately is a fairly typical job or life. I had a job for 4 straight years after residency, and it was pretty typical. I worked for a large integrated health system, 2 different ones back to back, and that paid the bills, and I got to take care of patients, and that was nice. And I had a nice relationship with my staff at both places that I was at, but it certainly wasn't something I looked forward to each morning. I still had a lot of work dread, unfortunately, and I thought maybe that was just going to be my life in medicine, just how it was for me. And I eventually, I think, got unhappy enough with work that I started looking around and noticing things about the hospital system that I was part of that I wasn't a fan of. And I started speaking up and banging my fist in meetings and saying, what's going on here? Why are can we pay a little attention to the patients and the employees and the staff and not so much just the spreadsheets? And eventually I have a feeling that got me fired. One day they just said, you don't work here anymore. Essentially, it was without cause, but it was out of nowhere. And I have a feeling for political reasons, let me go despite really good reviews and good relationships with my staff. And they couldn't point to anything wrong that I did. So that launched me before I thought I was ready on this path. And I'm very grateful that they had the foresight to do that, because I'm so much happier now. And I look forward to Mondays. I was just saying that to a friend on the phone this morning, and that's never happened in my life, even before having a job, med school, residency, high school, anything like that. And now, despite not having a big paycheck, I get excited about Mondays. I love the weekends with my family. I have 2 young kids, and I love being with them. And then I love going to do what I do for the patients that I serve now. And it's truly just because it's aligned with what I was meant to do as a doctor. And big paycheck or not, that stuff will come. And I know that will come down the road as long as I take good care of people. But it's really a joy to be doing what I'm doing.
How long have you been open now?
I incorporated in November of 2023. That this abrupt termination that I was talking about was August 8th of 2023. So I pretty much hit the ground running. I just said, I'm not going to get it. I'm never going to have a job again. I don't want this. This clearly wasn't working out. I think a few of us throw around the word unemployable in the best way possible. And yeah, I will take some blame for how things turned out, and I try to have the ability to reflect and understand what I was doing that wasn't aligned with my position. Right, I was an employee. There's a lot of benefits you get as an employee, but there's a huge amount of trade-offs too, and I was kind of wanting to have my cake and eat it too, because I'm a doctor and I can't just look at things and say, well, whatever, I just have to see the patients and sign the charts. uh, so there is that always going to be that conflict of when you make a doctor an employee and their bosses, especially when their bosses are not doctors, it is never going to be a natural fit. And there's always going to be this friction and intention. So that's what I was always, that's what I felt that I was fighting with and dealing with. And I can't have my cake and eat it too. I can't tell the CEO that not to buy another hospital, because we're still reeling from the last hospital you bought, even though I know your big bonus depends on how many hospitals you buy and how big you get. So that, yeah, you kind of get it. I needed to be my own boss, and yeah, that was November of 23, and I saw my first patient in-house in, I think, June of 2024. I was seeing patients virtually a little bit before that, and like you said, I do the podcast as well. I like to work with industry colleagues. I like to just leverage myself in any ways that I can that are aligned with who I am and how I take care of patients. So not all of my time is spent doing direct patient care, and things are still evolving.
I think it's really cool that you and I are sitting here with our medical degrees saying we're going
Mhm.
to do whatever we want. It
Yeah.
doesn't matter. So for me, I love the diversity of what we bring to medicine. I get to be here on the podcast. You've created your own, you're creating your culture, your
Mhm.
environment to help others do the same thing. And I really feel like this pathway allowed me to show up the way I show up best. I was not the person I really am proud of when I was working 60 hours a
Mhm.
week, 80 hours a week. But today I can show my daughter that this is what doctors look like. We can literally do whatever we want with our time
Yeah.
because we own it.
We own the means of production. That's something I've always said to myself and other people, and they want us to not realize that. I think they want us to not realize our value, the value of our credentials, and not realize that we can do it without all these layers and layers and layers of support and administration, just because of how complex everything has gotten. And that is, I think there's a lot of there's something inherently deceptive in that, in kind of passing down that and just letting it become fact for especially for young doctors coming out. Well, how am I going to start a private practice? All I've heard is how hard it is, and I'll just go get a job, and that's what these systems rely on. So good for you for being able to be that example for your daughter. And now I imagine sometimes you have easier weeks and sometimes you have harder ones, and fewer hours, longer hours, etc. But you're, at the end of the day, you're not coming home and getting angry at the kids when you're not, when you shouldn't be, because of stuff that happened at work or because of this misalignment. And that certainly, I find that in my life, I'm not perfect at home, but I'm not bringing home nearly as much baggage every day as I used to be. And like I said before, I'm excited to go to work in the morning, which is so different, and it's not something I ever thought I would experience.
Did you know you were going to open your own practice when you had that sudden termination?
I think about a millisecond after it happened, I figured I just wouldn't have a job. I didn't need to have a job ever again. If it was, I'm still grateful for the jobs I had and the experience I was able to get in terms of understanding and learning just how to take good care of people out after residency. Take care of people on independently and be the where the buck stops with me, and just getting good at that. And then once I got good enough at that, I could start looking around at the things that bothered me about the systems, and also thinking about, okay, well, running a business is a pretty big deal. And yeah, maybe, and there are difficult things, and you got to decide insurance, not insurance, hybrid, all this stuff. But I had the bandwidth for that. And I was practicing a lot. I was Dr. Una, who she's the founder and CEO of EntreMD, which is a business school for doctors. And she always talks about intrapreneurship or being an intrapreneur when you have a job. And that's how I treated my jobs. I treated my staff like I was there, like I owned the clinic and that I was responsible for them and the culture. And we were a little team and we were very different from the other teams that were also dermatologists at where I worked. And they would tell me that. And I think they appreciated that I ran things a little bit differently and stood up for them and took the time that we needed to be a team and have meetings that weren't just lunch meetings and, stuff that if I had asked for, I probably would have been said, oh, no, we don't, that's not what we do here. So I think being an entrepreneur was really helpful. And yeah, I just, the minute it happened, I just said, I'm ready. I wouldn't have been ready 4 years ago, wouldn't be ready 2 years ago, but I was ready. And I'm glad that they cut the cord because loyalty is a big deal for doctors and nurses and all this. So we tend to stay much too long out of loyalty to others and maybe fear.
So you saw your first patient in June of this year.
First in-person patient, like the exam chair you see behind you. I didn't even know if I was going to see patients in person. I thought I could do telehealth for a while I'm figuring this out. And I was doing that for a while. And I had a patient who I took care of via telehealth. And she said, I want to see you in person. I got it something I want you to look at it, whatever, or just, I don't want to do telehealth anymore. And I said, okay. And then I literally bought a chair and put it in the room and, you gradually accumulate supplies and there you go. And it's not quite that simple. You get it. There's some other compliance things you need to obviously just cross some T's and dot some I's, but that's how I'm running things. And that's, again, in the service of just creating access for people to dermatology and serving patients. And I'm really glad she challenged me to do that. And now I love seeing people in person. I also do telehealth. I go to people's homes if they want me to. I just do whatever is best for them within the constraints of what I feel like I can do in a sustainable way. And I love that. I also go to various areas around the state and see people through other people's clinics and just try to get creative because dermatology it's not okay to me to say the next appointment is 6 months or 9 months or whatever, even 4 months or 3 months. That is like my business card has 4 core values on the bottom of them, and access is one of them. And access to me means definitely never tell a customer that the next opportunity to serve them is 6 months away. And especially don't say it like, what do you expect? What do you expect? No, of course it is. Of course it's 6 months. This is dermatology. If that is a sign of an insurance dependent business, if they have that sort of customer service, because they know their patients are trapped. They have nowhere else to go. You are in network for them. So the insurance company is going to feed you patients all day and you don't have to treat the patients who are there well, because you're just going to have a steady flow of them regardless because of the nature of the system. So my practice, even though I do take some insurance and we can talk about that, I treat everyone the same, regardless of how they're paying. And I do not think that 6 months is an okay amount of time to say when someone calls you. So that I try to see people within a week or two. And if I can't do that, it's my job to increase capacity or close my practice to new patients. It's not just about making more and more and more money and decreasing the time of the visits indefinitely.
Let's talk about the logistics. You mentioned that you're taking some insurances. What
Yeah.
was your decision point to choose to take them or not take them? What was the process like for you?
Yeah. It started out much like you are and you have committed to, which I respect that a lot. I said, screw this. I cannot, these places don't respect me. These companies do not respect me. They're not aligned with how I want to take care of people. In my opinion, they don't put patients first. So I don't need, I don't need them. And they certainly act like they don't need me because of the way they negotiate and the amounts they pay and the ways they kind of abuse us and take advantage of our goodwill and our desire to take care of patients and the amount of paperwork and authorizations and just games in service of us doing unpaid labor to save them money. And I did that for a while. And then I found this kind of middle ground where in Wisconsin, at least, and I think this is happening everywhere, there is a groundswell of activity and a cottage industry arising from this of employers finally. And that's what's going to move the needle. Doctors can clamor all they want, and we can have great direct care docs and popping up, and that's really important. But what's going to move the needle is the customers, the employers, because they have the customers, given that just we tend to get insurance through our employers. So there in Wisconsin, there's these employers that are finally saying, this is a huge line item. We are paying thousands and thousands, millions or whatever for premiums, and they're going up 10% every year. And the broker gets to keep the broker just almost assumes that sort of raise every year, and they just take it for granted, and they don't give us a better product. It's usually a worse product every year, and the deductible goes up and the coinsurance goes up, and nothing really gets better. But it's just this kind of train that no one questions. So employers are now doing things called self-funding of their health plans, where they will send their money, instead of to United Healthcare or Aetna, they'll send it to a company that is actually aligned with independent doctors and says, we get it. Like, you're paying way too much. These places are inflated and the service isn't good. Outcomes are not great, all of this. So we'll contract with Dr. Lewellis, for instance, and he'll give us transparent prices. And we know he spends a lot of time with people and takes really good care of them. So if you go to Dr. Lewellis, you're going to have $0 copay and zero coinsurance, because we know his price is reasonable and we don't need to pass it on to you. And you're going to get a good experience with him if you get his tier 0 or something like that. So I have contracts with a few groups like that, which I love. It's amazing to know that my patient will be taken care of if it's a medical dermatology thing, and they have no copay, no nothing at all. They just get to use their insurance. So I do some of that, and then I'm now a member of what's called the Independent Physicians Network. I'm experimenting with that. With that comes a number of commercial insurance plans, just because it's sort of like a group purchasing organization, kind of, that we're all independent, but they get to, there's now someone I'm not negotiating with Blue Cross, right? Someone is negotiating on behalf of all the physicians, these independent physicians. So I'm giving that a whirl. We'll see where it goes. I'm fine with it so far. And so it's a mix. And then and I take Medicare and Medicaid out of principle right now. We'll see how long that lasts, but I think that's important. And I do direct care just like you. If they don't fit in any of those boxes, I tell them a reasonable price. I'll even negotiate, and we go from there.
I bet you the listeners are really interested in learning about this health share where you are connected to employers.
Mm-hmm.
So do they pay you directly, or is it still going into a pot?
It's there are a few different ways, but the most common way is these companies are called TPAs, or third party administrators, and they are going to pay me directly based on the rate that I negotiated with them. So they usually will go still using the standard CPT codes and things like that, because that's already so ingrained. So I'll say, these are my most common CPT codes I bill, E&M stuff, 992s, that kind of thing, and common procedure codes that I do. And this is the price that I would charge for them. And then we negotiate back and forth on that. Or they usually what they say is, oh my gosh, that's great, because that's so much less than the big hospital, like in the big integrated health systems, the dermatology department there is charging us. So we don't even need to negotiate, because your price is great. So, and it's also a price I feel good about. So if it's that, I send the claim to them, and they send me the check. And it's not like, well, you billed $200, but because of all these little things, we're going to send you $84.73. No, $200, and they send me a $200 check because that's what we negotiated. And some of them are like that. Some of them are a little more opaque, but nonetheless, it's still better than the alternative. But yeah, the best kind, in my opinion, is where I go right to them. I know exactly what I'm getting. We agreed on a price, and we can renegotiate that. And I also know the patient is not seeing a copay. That's good for me, because I don't have to collect it. And it's good for the patient, because they don't have to pay it. They're already paying their premiums. Stop having to pay so much and deductible and all that. So I know that no matter what I bill, their employer is taking care of that, not them.
I think that's really cool. It's another tool that we can definitely use to give
Yeah,
more access to patients.
you bet.
Essentially, direct care is exactly that. Doctors get less independent on a crazy corporation, but still
Yes.
allowing access and some sanity at the end of the day.
Hmm.
And I like how you said negotiate, but really the word is loosely negotiate because we
Yeah.
know that these big companies are not negotiating.
No,
They're saying
not.
you take it or you walk away.
Take
And
it or leave it.
people
Yeah,
like
we don't
me,
need you.
yeah,
Yeah, that's what that means to
yeah.
me. I don't need you. And that's what, why would I say I need them if they don't need me? So good point.
So tell me the progress. You went from opening last year,
Mhm.
telehealth. You saw your first inpatient here recently this year.
Mhm.
What is the logistics of your practice? Do you
Mhm.
have people working for you? Are you solo?
Yeah, totally on my own right now. That is not recommended. I'm not advocating for that, but I think the most common term for what I'm doing right now is a micro practice, probably. And that's just because I've enjoyed the independence of that. I do everything, especially because I take insurance. I believe in just again serve the people, just help people, and the value will accrue to me, in spades, in the end. And I just trust that. So I don't nickel and dime people right now over like prior authorizations and stuff. I don't blame anyone who does, and maybe I will do that at some point, but I'm just learning all the jobs. So I'm the receptionist, I'm the biologic coordinator, I do the prior auths, I do the billing, I see the patients. But that wouldn't work if I was seeing 30 patients a day, right? I see very low amounts of patients. I spend quality time with them, and I'm also doing a lot of other things with my time. So currently, and again, it is evolving, but currently I do all the jobs. But again, I don't recommend that. And I'm going to gradually growing and gradually delegating things. And I also have some plans for 2025 in terms of collaborating with another person in my area, and starting a clinical trials unit as well, which is something that's desperately needed in central Wisconsin. So a lot of fun stuff that's in store, and that will certainly turn into something that looks more like something that has a receptionist, a medical assistant, a nurse. Maybe I'll hire a billing team if I do continue taking insurance, all of that kind of stuff. But right now, I'm doing it all.
I heard you say if you continue to do insurance, does that mean that there is flexibility in what's
Sure.
going to
Oh
happen for
yeah.
you?
From every day that I have no commit. I don't feel any obligation to any beyond any contract that I sign. I will honor contracts that I sign, but those aren't like 10-year contracts. And there are also things that you can give notice, and it's not working out, give 60 days notice or whatever is in the agreement, and everyone moves on. And I believe that if I'm not happy, they're not going to be happy with the product that I'm delivering their members. So there's no reason for us to stick together. But I'm enjoying it right now, and it can be reevaluated on a daily basis. And eventually, if I had to forecast it, because I'm not the type of doctor who's going to see people in 5-minute increments, unless I really staff up, and I could see that model too. I like physician assistants and nurse practitioners in dermatology. I do not like the abuses that have brought us where we are, when a doctor purely out of greed has 10 satellite clinics and PAs and NPs at all those clinics and rarely sees them. That is not okay, in my opinion. But if you're all under the same house, seeing you're all there together, it's a team. I do not need to see every mild acne patient that walks in the door, nor should I be. And that's about access too. That's why there's 6-month wait lists. I tried to introduce that model at the place that I got fired from, and the other doctors were just like, "No, we don't do that here." And that's so. But I could see myself doing that. So anyway, if I don't, if it's just me, eventually I'm going to have a core of patients who are very loyal to me and really appreciate what I do for them. And I do specialize in, I like treating chronic inflammatory diseases where people need a lot of longitudinal care, but I'll take anything that walks in the door. And that eventually I'm going to run up against those constraints. Instead of, I'm either going to have to say, okay, it's a 3-month or 6-month wait, or I'm going to have to say we're kind of closed, or we're taking fewer patients, or we're only taking direct care because the market will satisfy that. So I don't I don't have any kind of like, I'm taking it for 1 year and then we're done, or I'm happy with how it's going. And when I'm unhappy, I will reevaluate and pare things down as needed.
I really like how you said that things are movable. We don't have to
Yeah,
fully commit
totally.
long term,
I don't think
month
so.
to month even.
Yeah.
I just did an episode about not signing on a 5-year lease. So,
Yeah.
it's good to know that life is flexible
Yeah.
and you can certainly choose how you want to practice with insurance, a hybrid, a
Totally.
concierge, completely
Mhm.
out,
Yeah.
totally up to you.
Yeah. I totally agree with that. Then I guess what I'm doing right now is called hybrid. And we mentioned concierge. People often, when I describe how I take care of people, and even say that, I do direct care if they don't align with the insurances that I accept, uh, people will often say, "Oh, so you do concierge?" And I say, no, there's a specific definition of concierge within healthcare, and that's not what I do, but it feels concierge to my patients. I give a concierge level of service, but it doesn't feel concierge in terms of what they're paying. And that is important to me. And that is at least what I'm doing right now. But yeah, my patients feel like I do think they feel like they're at the Ritz compared to when they go down the street to or the dermatologist they saw last month that they weren't happy with, because I take care of them.
You mentioned the Ritz, and I was thinking, what's the alternative? Motel 8? Oh my
Yeah,
God.
that's what it is. I had to campaign. I had to beg to get a Keurig in the waiting room because they
Mhm.
don't care. They don't need the
Yeah.
patients who are sitting there. So if those patients think, I think this place should be a little nicer, and I think my doctor should spend a little more time with me, and I shouldn't wait so long for an appointment, get out of here. Next person, next one up.
Yeah.
When I got fired, we had like 1,000 people on our referral queue as of the couple months prior to that, when last time they told me what the number was. That business does not need the people sitting in that waiting room, and that's how they get treated. So the bar is so incredibly low, and that's not a slight on the doctors. The other doctors I work were great. They take great care of people, but it is the system that is causing these. It's show Charlie Munger, show you the incentives, I'll show you the results. And the incentives are to see more and more and more and more patients.
Mhm.
And you don't get paid based on whether the patients are happy. You get paid based on whether you prescribed a medication or what the complexity of it was, or you froze something or cut something out, and that's how you get paid if you're insurance dependent. So that's yeah, the bar is really low, but I don't just try to skip over the bar. I try to leap over the bar, and that's pretty easy right now.
Are you doing marketing, active marketing right now, or do they come through the insurance pathway?
Both. Things like this, I consider marketing. I was just I stopped by a radio station, local radio station this morning for a program called Wellness Wednesday that a local station puts out, and they've had me on a couple times. I go on the local news. Last few kind of 6 months or so, I was once a month. Did a 3-minute live spot on the 4 p.m. news once a month, talking about a kind of a dermatology issue of my choice, and they would interview me about it. So that's all kind of earned media. It's not, I don't pay for it, but I work for it, and I had to get those opportunities. I do some print. I do some print marketing because I think that's undervalued right now. So I really enjoy print marketing within my local community. So people will see me in kind of a magazine or something like that. A little bit of digital marketing, to just experimenting with it, but not a ton. But now that I have got some friends behind here, I have a couple of lasers that probably combined, those things cost more than I paid for my house. So I need to pay for those and I need to put them to work. And the way I think about marketing within dermatology, people know what a dermatologist is, and lots of people need one. So I don't need to put a huge billboard saying general dermatologist. But if I have a specific device that is very good at doing a very specific thing, I need to tell the people who are needing that thing about it. And to me, that's marketing. Very specific marketing to your ideal customer avatar, not just like spreading it everywhere and hoping someone walks in. And I also care a lot about repelling people who aren't going to like me. So I never get a chance for them to give me a 1-star review and give me a headache, and attracting people who are going to love me. And why not? I don't want to I don't know, everybody vibes differently with different people. And if I can put myself out here in forums like this or my own show or the news, someone will be like, oh yeah, he seems like my kind of doctor. Or someone else will be like, he talks too much. You don't like his voice, stupid hair, or whatever. Like then they just get to sort of self-select before they call my office. Because I don't have a lot of resources to have this huge triage process and all that. So that's a kind of one of the ways I think about marketing. And yeah, so I do some, but my budget is not. I'm a very lean practice right now. I don't see a ton of patients. I got bills with these devices and stuff, and so then marketing is very. I try to be very specific about it, very strategic about it, so that I'm not wasting a lot of marketing dollars.
The doctors that are listening right now to you, they're probably inspired because I know I am.
Thanks.
What would you tell them about owning their own practice?
Do it. So that's the cheap answer. If you are happy with what you're doing, don't have shiny object syndrome because you're listening to TNI. But you're listening to us for two reasons. You're not happy with what you're doing, or you're doing kind of like what we're doing and you want to learn from people who are doing it alongside you. So if you're in the first camp of, you might be like I was, an employed doc who's just like, what's there? Is this it? I'm not super happy. And I feel like I'm not very aligned with what's going on here. And yeah, the money's good, but that's about it. That is the person who I'm saying do it. And it doesn't mean you have to do it right away, but just start planning for it, start learning, start building a financial cushion. That's huge. I'm a pretty financially conservative person. My wife and I both, we don't want to be living paycheck to paycheck and being house poor and having 3 houses and boats and all this stuff that we can't sustain. So this would have been a much more traumatic. It was already traumatic, but it would have been so much more traumatic had we been like, oh crap, like where's the next paycheck going to come from that is the size of the old one? So I will gradually work up to that paycheck and far surpass it. I have no doubt, but that's a long game. And those results will come because I'm playing the long game. And I have the ability to do that because we did build up a financial cushion, and that's important if you want, especially if you want to stay independent and not take on a ton of either investors or a lot of debt. I mean, I finance things, I finance the devices and stuff. So everybody do it their different way, but do it and reach out, talk to T, talk to me, there's a lot of us out there, and there will only be more over the coming decades because of what the big systems are doing to push us out and make us miserable and hurt our patients and all of that. So the water's warm. It is wide open and the patients are waiting. They're desperately waiting for you. They're desperately waiting for a doc like T who's going to be like, I got this. I'm going to take care of you. This is how much it's going to cost. You're going to get way more value than you thought you would, than it feels like you should get for that amount of money. And we're both going to be happy. So my wife said, she doesn't say this, but I think she would say I talk too much. So I always picture her sitting on my shoulder saying, shut up. But she's a very nice person and she doesn't actually say that.
Who doesn't like a doctor that likes to talk? It's very engaging.
Oh, yeah.
I'm sure your patients love you so much for that because you're right. 7-minute medicine, not working anymore.
It ain't for me, at least. And yeah, I joke that I now in my new job, I will have patients looking at their watch and being like, I gotta go. Like, is this guy ever gonna start? Am I ever gonna get out of here? And that's obviously I want to be mindful and respectful of my patient's time, of course. But I think people do value, having a 1-hour consult slot if they got a big thing going on. They was suffering from something a long time. They've seen a dermatologist. They saw an allergist already. That was my patient this morning. In fact, had seen prior multiple specialists, and that patient is not going to get any value from a 5-minute visit.
Agreed. Well, thank you so much for being here on the podcast and for sharing your journey. I know it's new and fresh, so you're very close to the ground, and I find that to be incredibly valuable because it wasn't too long ago where that stuff was scary to me, and now that we're finally on the other side, it's like, oh, what took so long?
Yeah.
We'll get there. We'll get there.
Yeah. And the challenge is just keep getting different, right? You get to that plateau, you see another vista and a view, beautiful view. It was you're scraped up and you have you get your rewards and all of that. And then it's another one, right? But you have a new skill set. So you have new equipment and all this new connections and skills to climb that next one. But it's not all about just climbing. Like, look at the view and enjoy it. And I'm sure you clearly are. You're very authentic in how you come across, and that's because you're doing what you were meant to be doing. And all of you can do that. All of the listeners can. There are many patients out there waiting, as I said before. And your skills are hard earned and extremely valuable. And don't let other people convince you otherwise, because they are generally the people who know exactly how invaluable you are, and they don't want you to realize it.
Dang, how about that, guys? Thank you so much for being here, and thanks for being on the show. We'll catch you next week. Take care.
Thank you. Thanks, T.
If you enjoyed this episode, please give it a review and share it with a friend so more doctors can learn about direct care. Let's keep the conversation going on LinkedIn so we can help more doctors escape insurance and thrive in private practice. Thanks for listening. I'll talk with you next time. Take care.